So this is the online application for the MDCE license. So if you go to wmc.wa.gov or just Google Washington International Medical MDCE license, you get to this page. And this is the online application portal, and there's also clear instructions there. This is what you'll need to get done. So if you go to the instructions page, you're going to create a login here for your account. Once you create that account, where did mine go? Let me go into mine. So when you create that account, and you verify it, it's gonna say My Services. And you're gonna add Health Professional and Facility Licensing or HELMS. This is the Department of Health and how they license you, and it'll connect the services. So once you've done that, let me see if you can go. You would click on this, and that gets you to HELMS over here. And so this is where you're going to start filling out um your licensing information. So this is my information here, but let me see. Okay, sorry, I have to stop sharing the screen 1 second. Um, because I can't see everything on here. But once you get to Helms, that's where you're going to go into that and start a new application for a professional credential. So now let me share again. Sorry, it was okay. So you start a new application. When you start the new application, you're going to go to the physicians section. And
Sorry,
it's
what is the URL for this?
so this is all through the portal. So you're going to start on this page. Like I said, you click on the online application. The online application is going to get you to this login. You're going to
What's the name
create,
of the page?
sorry.
The page, the URL, the page. What do we go to?
It's
Oh,
right here at the top if you can see it, but if you just Google Washington MDCE license, it's one of the first links, and it'll look like this, and then you click the online application there. When you click the online application, it's going to take you to a website here where you're going to sign up. Click right there. When you sign up, you're going to create a username, password. It's going to ask for all that information. Once you create that and authenticate your email, you're going to get to this page where it says My Services. On the My Services, you're going to add a service, and that's the HELMS license. When you get to the HELMS license, you're going to check a login there, and then you're going to start a new application. And the application you're going to have is the Physician and Surgeon Clinical Experience License right here, which is equivalent
that's
to MDCE license. Then you're going to go next. Um, this is continue, it's just information. All right, so you're going to put your information. It'll ask Social Security, address, and all that. You'll go next. Oh, I may not be able to go through it because of the fact that I don't have everything, but it's going to ask now all this information. So the National Provider Identification Number. This is really easy to do. You just go NPI. and it's NPI registry. Here, you should be able, here you go, NPPS registry. Here, you're going to create an account. It's going to ask you information again, and it'll give you, once you're done with that, it'll give you your NPI number. And that's what you're going to enter here. Oh, there's too many questions we have to, okay. So I'm not going to go through everything because I feel this is like pretty redundant, but the question I always get is which type of license, and that's the physician and surgeon clinical experience. So just look for clinical experience under physician, and then you'll add your number, your information here. Just putting no for now. And then you'll put your, let me go next. So it won't let you go to the next page until you save. Then you put your NPI number. It's good to have it beforehand. I have one, but I'm just going to put some random numbers. Okay. And then again, so training and education, again, it's you're going to add your official transcripts and everything, listing your medical school. Postgraduate training will be residency. Um, if you had a training and the evaluation, and then the rest is just everything that you're experienced from the postgraduate down to malpractice history. That's any licensing history, any experience that's relevant. Once you get to the federation credentials, let me see if I can get there. It won't let me. Okay. So I'm just putting my, you know what, just leave this. So the big thing people always get is the Federation Credentials of Verification, FCVS. So for that, there should be a link, but if you just do FCVS, here what you'll do is you will create a login. See where that is. Here we go. So you'll log in here, and what this does is it's going to ask you to verify your medical school information, your any training you've done, and it'll create a package, and it'll tell you essentially it'll tell you where to send that letter, um, and that'll be or that package, and that'll be to the Washington Medical Board. And when you get to that page, I think I have to add here. Let me see if I can add it and get to that page. Let's do that. So you can say yes here, and then you could rest this will send all your credentials directly to Washington Medical Commission. Um, and then this is if you've trained outside the US. Letter of nomination will come later with the physician practice portal. AMA, FSMB, don't need to worry about. And then if you have your ECFMG, that also goes through FCVS. And then again, that's just the USMLEs. Proof of residence no longer needed. And then practice agreement is a separate portal. Okay. This is no longer needed. Um, the proof of residence in Washington. And that's pretty much the whole application. So really easy to go through. The main thing that you have to do is the NPI number outside of it and then creating your FCVS. If you haven't already, FCVS, creating that account through FSMB and sending it makes it very easy to get your credentials all in one place, and you just submit directly to the board instead of having to upload it yourself. Um, okay, any questions? So yeah, so NPI number, if you have a medical degree, you can get an MPI number. Um, I see that people have written that they have internship and yes, internship counts as postgraduate training. Um, I don't know if it counts as completed graduate training, but you just would write how long you've done it and if it's complete or incomplete. It's kind of like if you graduated. And then in terms of NPI number is just you can register for it regardless of if you're already practicing or not, or have the MDCE license. It's just a number that verifies that you and your degree, pretty much. And when you start working as a hospital, at a hospital or a clinic, that NPI number tracks where you've worked, and then possibly if there's a medical malpractice lawsuit or anything like that, or anything that kind of dings you, they ding it through the NPI. And it's a way to just track your where you've worked and in what capacity as a physician or medical, like a medical student sometimes have it. Residents definitely have it, and then of course as an attending physician. Um, okay, first I see Rajesh has a question first.
Yeah, you totally lost me here. Um, I I clicked on this and it goes to Secure Access Washington and then add service. Do I add DOL professional and business licensing
No, that's what I
under
was saying
Department
was
of Licensing?
HELMS. That was the HELMS.
I don't know. I don't see HELMS anywhere.
It's if you just put health in, it'll show up.
Health in the My Services or ad service.
So hold on. I'm gonna just put in the application instructions right here. Because this seems like so I put the initial link
Okay,
in
health, right?
there. Because that was just a quick overview. The instructions are there, and you can probably review this afterwards, Rajesh.
No.
And if you still have issues, you can do a consultation. But I want to keep this a
Okay.
little more focused. So JR,
All
you have
right.
a question?
Hey, Dr. Hina. I have actually submitted my app. Can you hear me?
Yes, I can.
Okay, so I did actually submit my MDCE application this week on Tuesday. Would you know what's the approximate timeline for its acceptance? Because I did my credentials to FCVS, as you said.
Mm,
So that was pretty easy because I think they could send it directly to the Board of
exactly.
Commission.
Right.
Yeah, the only concern that I have is my application still shows the status of pending. So I'm not sure, even after submitting, like if I'm missing something in context of documentation or, what's the timeline?
Do you mean on the MDCE license portal, it's saying pending?
Yep, yeah.
Oh, so
Like
yeah,
after
it's
I
gonna say pending.
submitted
And
and payment.
so yeah, so it takes anywhere from 3 to 4 weeks to up to 2 months. So 1 to 2 months. Depending on what they have to verify, where you went to school. Some
Mhm.
places take a little longer to verify, but that's why FCVS is great because they do all the verification for the medical commission, and the medical commission just has to look at it and sign off. But it takes still time because they have to do the background check and everything. So that's always time consuming is the background check and checking your NPI to see if you have any malpractice. But generally 4 to 6 weeks, I think, is the average. And that's
Oh,
normal tenure. Um,
okay, okay.
and you have a job already lined up, or you just
I do.
okay.
Yes.
Then yeah, so 4 to 6 weeks. And that's
Okay.
generally how it is for all states I've seen licensure for.
Okay, got it. Yeah, that really helps, I believe.
No
Yeah,
problem.
thank you.
No problem. And then let's see. I'm going to stay on the license applications first, and then I'll go into finding the jobs. I see that Ethan had a question about hospitals. So they're done. How about Washington State? Yeah. So Psy again, 4 to 6 weeks. That's just standard because the longest part is the background check and just the verification through FCVS. All right. So in terms of, so now this is the part where I know is difficult, and Timga has been actively working on it, but it is unfortunately hard to get a job. It'll take time, but what I've seen is that after people have applied, um, they get interviews in like about 1 to 2 weeks. So, the way we have been doing it is, the advice I've given is you should look for either nurse practitioner or physician assistant jobs. So I'm going to share again. So this is just an example. You would go on Indeed, okay? Um, so this might be a little too big, but this is an example of a job at a trauma center. So when you're looking for these positions, what you need to look for is a clinic that has from 3 to 6 physicians working there. And they're kind of smaller than bigger health like clinics. Um, some like this one, let's see, these are all surgery. Let's see. So like something like this, where it's population health. This is a part-time job. What you would do then is this is the kind of, let me get this full page. No, that's going to the application. Sorry. So these are the kind of jobs you'd be looking for, and the main point is to look, they know this is not your license is unusual because not everyone has heard about it. So what you're going to do is you're going to submit with that a cover letter, and let me share this cover letter that I've been sharing with everyone. Let me get it open. 1 second. Okay. Actually, this is a really good example right here. And I saw in Ketchi that you had a question. Give me a second. Let me just share this and then I'll get to your question. So this is a job right here that is a good example. It's an urgent care. 130 to 155, like that's good because it's not shortchanging you on salary. And this is a new clinic that looks like it's opening in July. This is something some of you could start applying for. Um, but urgent care is a really good way to get experience and get learn really quickly. So what you would do is I would suggest some job like this, and then you would have this cover letter. So this cover letter pretty much explains what the Washington MDCE license is. And it gives the link, and then it also gives information for who they can contact about the license. what I say is attached on another page after this letter, add your own cover letter that explains your background, your your experiences and why they should hire you. And I think the real way to position yourself for this is to say that you are a qualified physician that is looking for clinical experience. And this license now actually, it was just signed in this week that this license leads to full licensure. So you would say you wanted to work with this physician and after 4 years, you'd be eligible for full licensure, which means you could work as a full physician with them in the future. So not only would they be training you, whereas before it would just be training you, and there would be a kind of dead end to that license. Now there's a pathway to work as a full physician. And so in your cover letter, that's what you need to position yourself is that you're qualified, you're looking for somewhere where you may need some training, but you're ready to work and be hands-on immediately. And then in a number of years after working with them, you would be a full physician and want to continue to work with them. And this is long term. Um, I try to like tell people to when you're talking to them in person, and you get to that interview, like tell them like, they're helping shape the future physicians that would be working there. They're helping to train them and give them a chance to practice, whereas the way residency is, you guys did not get that chance for whatever reason. And so that's what you're angling at it as, is that you are qualified and you're just looking for the opportunity to train and eventually then now with this new legislation to work with them. Okay. Does anybody have any questions?
Yeah. You said you posted the instructions in the where did you
It's the
post them?
link. It's the link. It's not my instructions, it's the link that has the instructions.
All right, because I found
But
them online, but it's still very difficult for me to get to find out where. Anyway, oh, never mind.
okay. I just put in the cover letter that we've used for TIMGA for that MDCE license. All right, does anybody have any other questions about applying for jobs or the application? So Elizabeth, I see your question. I have not looked into the Texas provisional license yet, but they would have their own separate licensing. I can take a look right now. But they would have their application process. And I believe this is the website for it for Texas. Should just put in the chat. Does anybody have any other questions or any okay, sorry, let me see in the chat. Yes, Ethan, that is exactly correct. The thing is, most of these jobs, unless they're through us, they don't know about this license just yet. So you're advocating on behalf of the what? And Ornella, it's in the chat, the MDC cover letter Word document. I have that cover letter there. But the reason you're looking for nurse practitioner or physician assistant roles is because you're at that level, because you need a collaborative practice with a fully licensed physician. And that's why you're kind of competing with them in a way, but you're temporarily competing because now there's a pathway to full licensure once you have been with a license for 4 years. And that just started. I don't know about the eligibility to take the board exam, but I are questions that probably Mohammed can answer now that this like because I haven't taken a look at the full bill, but I don't know if you would be a board eligible. I do know you would get a full license, but you may not be board certified. So that's a nuance I'd have to ask Mohammed. And maybe we can do a seminar on the new proposal and what it entails and what it means to convert to full licensure. So the license, once you get to full license after 4 years, which may not be mean you're board eligible, you can work in Washington State, but only Washington State. It does, I don't know if it'll transfer from another state because other states, when you have full licensure, they'll require proof of residency, and you don't have proof of residency because you haven't completed it, unless you've completed a residency in another country. So that's where it gets complicated. No, you shouldn't be under a breach of contract penalty because there shouldn't be unless you sign a contract where for that job, but you can't sign a contract with a program that you're working on the temporary license. I don't believe you can sign a contract where they say you cannot leave the job. Um, and there's also I don't know Washington's rule about it, but there's no you have to look at non-compete. Like in California where I'm from, any healthcare worker does not qualify for a non-compete contract. So you can leave the job whenever for another job. So with Washington, breach of contract penalty, I don't know those laws in Washington, so it depend on if you signed something that where if you breach the contract where you leave the job after a certain number of time, that they'll penalize you. But so many people have worked under this license and left after only a year or so of working there and not even a full year and left for residency without any issues. So it's quite common right now for people to have this MDCE license and to have gone on to residency with no issues whatsoever. Okay, anyone else have any questions?
When we put our information, we have to put our exact degree, right? We can't just see MD. If it was like MBBS, we have to put that, or like any other, the
I mean,
official
yeah, just
degree.
like you would fill for residency. Like you have to put the true degree. You can't just put any degree. Like it has to be what your degree says.
Right.
Unless it's
And
like,
also another thing is, some years ago, I did enter all my information to FSMB. But recently, when I looked into FSMB to see, and then like all my credentialing information was all lost. So I don't know what happened. Uh,
that's something you have to take up with FSMB then.
yeah, I
Or
don't know if anybody else had
yeah,
that experience, but
you may have to create another account because it might have expired. But that's with FSMB. And that's up to their discretion why they would have anything. Yes, we
okay,
can Salamowit, we can I will speak to Mohammed and we'll try to arrange something for that so you can understand what the future for this license looks like and what the process will look like because I believe it is a pilot program and as long as you get issued the license before July 2026 you will be included in that pilot program if you wish to get to full licensure. But again, I don't know all the details, so we can do that and explain exactly what that is. Yeah, Rajesh, you had a question?
Yeah, sorry. So the license is valid for like 2 years, right? Okay. Uh, and we can renew it 3 times, right? Okay. Um, Supposing we don't get a job like for a long time, like, and we have the license sitting there. Um, I mean, isn't that going to shorten the length of training that we can do?
No, because your license isn't issued until you get a job.
I see. Okay. Okay.
Yeah, Charles, that's gonna be an issue. That's been an issue with all these licenses in every states. Um, in general, like some states like Missouri, they put it um, in the bill that you should bill as a PA for this license. Um, so that unfortunately that will be and that will continue to be an issue. Um, hopefully we can start working out some of that or find a way, but generally there are still people there are still that recognize it to some way. Um so yeah, so unfortunately that's just one of the nuances about this license and other licenses is because they don't recognize it separate. There's no, there's a category for residents, there's a category for physicians, there's a category for PAs and nurse practitioners, but there isn't a category for MDCE or an equivalent. So usually the way people bypass it is because you have a collaborative physician, they get billed, and then you're not the one getting you're on the let's say you're the one seeing the patient, but they bill it that the physician is it because they're supervising you. So that's kind of a way to go around it, but it's complicated and that's I'm not sure how we can get around that. Okay, so I say Ethan, you said yes, you do need to secure a job before you apply because you only have 2 weeks to complete the application. So what I would do is you know what you need for this job, like application. I just went through it. Um, Make sure to just get your FSMB account ready to go. And then once you get that, get your NPI number. If there's anything else you see you need, just get it ready. Um, but once you start that application, you only have 2 weeks to submit. Um, so I would actively just make sure you have everything ready so that um, once you get a job, you literally can apply that day and then get them to get on the portal and then expedite the process. Anyways, onboarding, everyone knows, takes 1 to 2 months, even if you're not an MDCE. For physicians, it can take up to 3 months sometimes to be credentialed and move to a new job. So there's always leeway. Um, so actively, you need that MDC cover letter that I submitted, your own cover letter right below it, have a resume ready, and start strategically applying to these jobs on Indeed within Washington State. Um,
Right.
Another way people have gotten these jobs is they've called clinics, like they've seen clinics like a primary care clinic near their home or their own primary care clinic, and then talked to those doctors and said, can I schedule a meeting and then kind of, showcase their talent and uh, how competent they are to secure a job. And then, um, and then once you do that, so there are like other states that issue the license before you need the collaborative practice, but for this specific license, before you can get anything, you need the job in hand. Rajesh, I saw you had a question earlier.
Oh yeah. You have to be a Washington resident, isn't it?
No, that was taken off as of last year of June. So now the
Okay.
license no longer requires step 3, and you don't have to have any proof of living in Washington State.
Okay. And a licensing fee. we got to put it up ourselves, or the employer may pay it. I don't know. What do we do?
I think really everyone has been paying themselves.
Yuck.
I don't think I don't know how much it is.
It's 497 total fee,
Okay.
according to this.
Generally, same with physician licenses. It depends. Sometimes the job will do it, sometimes you do it. It's something you can negotiate, but I feel you would either way you would have to put the fee up first and then maybe they'll reimburse you later. But honestly, like it's there are a lot of jobs that even make the physician do the licensing fees and stuff themselves. So it's not it depends on the job and if they cover it or not. Some do, some don't.
Okay. Okay. Thank you.
Okay. Okay. Does anybody have any other questions or concerns about the license or applying for jobs or any other support that they might need for this process? Okay. Well, it is a Friday evening, and I appreciate everyone joining at 5 p.m. on a Friday. I'm sorry that I wasn't able to do this earlier in the week, but my schedule is a little difficult to plan on a Monday through Friday. Luckily today I was available, but essentially the application to DCE is pretty straightforward. The biggest hurdle is finding that job, but hopefully with this cover letter, adding your cover letter right underneath there and having a strong resume and applying for these jobs, you'll get an interview. People do get interviewed. So I think the biggest thing is once you do secure an interview, practicing for that interview, um, knowing what kind of questions to ask them. You are all qualified physicians. It's you may need just like a training period, which everyone would need anyways, just to get accustomed to the job. But then after that, everyone has been very successful in this job, whether it's continuing to work under this license or deciding to go to residency. And now with this new pathway, it there's a lot of promise and you know there before there was no opportunity other than residency and now there is. So you guys, whoever gets hopefully all of you will obtain a position before July 2026 so you can be included that first cohort and in 4 years we'll or whatever we see you as fully licensed in Washington. Yes, Rajesh.
Yeah. Are they gonna really, is it gonna be like an interview like what you typically get in the residency interviews in the regular math cycle? You know, the way they
So that's dependent on the clinic how they do the interviews.
all right. And
Not everyone is the same way.
okay. And have scores and attempts been an issue for applicants?
I am not sure. I haven't heard that be an issue for anyone in obtaining a job.
Okay. Do you know if Washington State has a temp limit like the way Texas has, or like some states are stringent about maximum number of attempts on any of the steps?
Um, I don't think Washington is one of the states that has a temp limit. I know like Illinois is one of them. Um,
Texas has a maximum of 3 per step. Last time I checked, that was years ago. I don't know whether they've lifted it or
it's just 3 attempts for step 3. That's it. For Washington, but you have to complete like every other is that you have to um have completed all of them within 7 years. So from step 1 to step 3 it has to be finished within 7 years.
yeah. Okay.
Hey, Anna.
Yes.
Uh,
Or no.
yeah, for some reasons I am on the phone and I'm not able to download or find the letter. Is there another way that you can share that?
Uh, can you access the chat?
I right now I lost everything. I don't know. I was driving and I don't know
Okay,
what I did.
Okay, what I'll do is I will let me do the links again. So if anybody missed it, I'll put the links again and I'll attach the cover letter as well.
Thank
Uh,
you so much. Really
and then
appreciate that.
if any of you need the cover letter, you can email me at henna@timga.org. So that's my email. Here, Washington, MD. I'm putting the links again. And then okay, so I've put the instructions and then I'm attaching right now the document again. If you're still unable to get any of this, you guys are welcome to just email me at henna@timga.org and I'll send you the cover letter. All right. If there are no more questions, I've already taken an hour of your time and I appreciate all your patience, especially on a Friday night. But then we'll conclude the webinar for today, and I will definitely get sorted that next webinar for the pathway for full license and what that entails. And Dr. Muhammad will take part in that. All right, well, have a good evening, everyone.